Hello and welcome back to my channel. Hey, when hunrei tak no video on siam le dona kan channel min clear chin tu te kanon alo no vek sewa going to nisa ni sa thal kwa rawa sun allergy kan ti me nisa banga kan tuna thil lo chin common tak ni kata mi so ma tanga so banga tan chu kan chinang ti am vel karon soi dona chu Mizo trong chuan an ning kan nei chia lawa ni zung dat na han ti la mang be ro me. So today I will be talking about something which we very commonly see in this summer months, which is a form of an allergic reaction basically induced by sun exposure. In this book it is called polymorphic light eruption. Polymorphic light eruption, PMLE, polymorphic light eruption ti ni ha. Chuan omzia o polymorphic omzia chu chi sang in ron lang chuak thina light eruption kan ti chuan nisa ni zung wanga ron chuak ani vero me. So it's usually caused by excessive sun exposure, and with upcoming summer months it is very common. And what exactly is polymorphic light eruption? So polymorphic light eruption is caused due to repeated exposure to UV radiation. Both UVA and UVB can induce the lesions. Sun rays ti sang kan neya ni zung ti sang oma UV radiation A, UV radiation B, UVA, UVB kan ti a chung chuanin heng hi atlentir thei ve ni shim do na sa entirna tu lai blanket suk season te ani a thalai na tlang te e an na tlan zo atuk le ve la da rin entir ta puya e tin picnic season te lo ni buka kha khan lo kalan tam thina ni chuma chan nisa vado vak zo aram nom chin tina ni chu. It is most commonly seen in women, and it is commonly seen in women less than 30 years of age. Mecha common zo kan tiklat meya maro chu kan practice a chuanin e an statistics se adik che lo na chin po me dia mi pale mecha chu kan hudan ai nang reng hian ka share ke ma ka practice bi ka chuan. So how does it present clinically? What do we see? We see lesions which are papullovascular lesions, large plaques localized predominantly in the photo-exposed distribution. Omzia chuan aron lan chuan chang thea bol te tlede ser te bol chhuak herlo te pana thak thina basit heta in kan sharing tur chu aron lan chuan tamber chu ni mutam lai mai long om heta nung lampang mi pa pe chun helai a common emema an samte an no tha velem lawa sam toy nitlang pui wagi na commona tin ba na po helai ni em tam na lai am thina tin ki por bul hatama chuan ni na em tam na lai chon wai lampang mo ni na em tam khanom thei ta ni. So we usually see the sun exposed parts, as I've said, on the face, V of neck, the nape of neck, on the extensor surface of your arms and forearms, and you can also see in your hands, on the dorsum of your hands. Kan chuma te point ko man du ta ni chuan tlang puin anon kalyanin kanghonga ringworm oma hinon ti tlang pui thina ni thanglo tan chuanin ringworm te po ang lek amaro chu I kan lo en hi chuan ringworm ani lo ti kan lo shathiam phal me thina chu han soi fia vak ve da chu ka lo nangin ringworm amo in ti kha ka soi tum zo ka chu ringworm amo in ti kha in hong om mun khat om reng in spread si lo kum tin lo chuak ni sa va do piang lo chuak helai ta pin helai ve lo chin hi ni ta ni pa sam helai hong nung la ba te poi lo chin ta khang kha ani chuan ringworm ani lo the ti ka sha tur ani le ni lo kha chu han soi fia kha har sa ni ge ni chuan in kan en thana ba in kan chado ta ringworm ani lo theya ringworm ani lo chuan ni sa ba ani thei thawem po ti kharil ro khan ro ve se. Many people have come to us saying that they have ringworm over the neck and other sun exposed parts, but usually when we see with our trained eye, it is usually not a fungal infection but a sun allergic reaction. So it's usually very commonly seen out here as a round oval shape, slightly shiny plaque over the skin lesion over the neck and the back of the neck. Sometimes in farmers or people who are exposed to sunlight on a very constant basis, you can get it over your scalp, your forehead, your cheeks, those areas also. Nisa do nasa nathona wanga nisa om nasa tan vi zwanin luleyate mai bianki lai nar heta khabe helai ma te han ane chau thea chu ringworm mati ole mema maro chu sharing tur chu nan da shikwa ni lawa allergy ria tin adam doya po treatment ko atih na oma atih na kan tin san chu allergy reng a chuan azia a ithil wa ta ka even expose le chuan alo om nan ne thei ni ringworm te chu nan da shikania anan da shikhadam doi manga kan ti dam chuan iwakai non le ni lo chara dam mak thei ni amaro chu tunda kanon so hi chu skin allergy ani na angin nisa allergy ni zung nan na ani angin adam mak lo na chance ka am thina ni nisa va in expose apiam kan reid de unile ngan nisa va do te khan na thona wang te ponianga khata khan om nun ne thei ni as I've said these things are allergic reactions to sunlight, so it is not like an infection like the fungal infection, which is ringworm, as I've said, which can be cured, totally cured with medications if we give them proper treatment. But for this kind of skin reactions, which are allergic reactions, they can occur again. You can have it every summer also. You can have it after every extensive sun exposure, especially if it is related to your work. For example, a farmer who has to go, even if it is on a very sunny day, he has to go and work in the fields for the whole day, he can have those kind of skin lesions coming every year or every time he goes for work. Adam doi lama hi chuan apoi mo ver chu a treatment a chuan an chi te ana sakphei chona e chi te kan pe thina chung chutlam pui steroid ani meya steroid kan ti hianin mani lo in chaw ve ngot hi a him ber thin lawa amaro chu thingtlang omte doctor ron thereng lo in ni chona cream lo in hoi te chu a him thawa amaro chu steroid kan ti chi reng regi chu kar thum ai re hoi lawa tha chu the share ren tur dia. The treatment includes basically steroids, which we can give orally depending on the severity, and the steroid creams and lotions. And also very important is limiting your sun exposure as much as required. Nisa do claim ka treatment at king del vetho ti na nia alo thei lawa nisa na thokte moni tin chok mi kan ni chuan in ve na ngai ta ni bana om thanga ni chuan korban ton hakte tin kut hetia mang nisa two wheeler khala ti chuan korbun te tin I nilengan na thok tur ni chuan lukhum par nung thlok matlok helai veng le malam veng tur te tin mi pa chuan sam kan tha mai lo chuan korhong nei te an tam takin a veng ve thawa tin I helai veng tur chuan korhong chi deu te mo scarf te mo khatiam hakha apoi mo ememani khata han ka soi du chu I kan material ka apan viang chuan entinan lace amon ne tamo kan man chuan ni zum kha alun vek thei thawa kha kha ni na vek to wa chuwang chuan kan material kan korban ton hakon korban ton ka hati kan lacy hak chon umziam chong ti share tur. So as I've said, you have to have protective clothing, which can include long sleeves shirts, can use gloves for people who are exposing themselves for a prolonged period, or maybe for people who are driving two-wheelers. Men, they can wear collared shirts to protect the back of the neck. They can have hats or caps to protect the scalp and the face, and also the neck. And as I've mentioned, it is always very important that the material which you are using, for example, if you think you're wearing a long sleeve shirt, but if it is a very thin material or if it is a lace material, the sun rays is still passing through it, so it is of minimal use. So you have to wear something which is does not allow the sun rays to pass through. So it kan invent ka poi mo bakani tin heng ba ka yan niliap te war turani a toite te ka zon bon hetiang ne sha chuanin niliap ka man war turani. You are supposed to be very careful regarding your sun exposure. Even if you are walking for a very short distance, it is good to use umbrellas in those instances. Dam hi to atam nang kan detailing kan soi lo ba kan stress tu pero chu invent ka poi mo a tin dam mak thei ani lo na lai ka kan shan le tura kan tu chu ni a dam mak thei ani lo na lai a khan nang mani lo invent nan ka poi mo event kan soi du ka tin sunblock kha soi to in sunblock man nge ngai sunblock kan man khan hetiam problem nei to hi chuan SPF 30 atanga 50 tal mana tha a tin sunblock kan doing jing lama mai pum om heta ban thengin kan hoi turani sunblock in za tu ma avel lo awangin sunblock man pun korban tote tiang in invent kan soi to song ka I detail tho a tha ni Sunblock is a must for these kind of problems. And when we talk about sunblock, you can use either a physical sunscreen or a chemical sunscreen. SPF minimally, usually around 30 to 50 would do. But when you apply it, you have to apply on your face, your chest, the view of your chest, your neck, all your sun exposed parts. Even if you're wearing sunscreen religiously, you are supposed to protect yourself with the protective measures like clothing or gloves or hats or caps, which we have mentioned previously. In vega po yung MMT siya doon ni. So sunblockation by video kanon siyam lenga to like kan mutam pero ni ba yung video naman siyam tinani. So na ni comment naman so niya.